Okay, more questions from March.
It's not a question. I just wanted to say that I was reading some of the ICD-10 codes, and it's really funny. I mean, it's good for a laugh. There was a fall. Like I'm a rehab physician, so I'm thinking falls, right? So I go to falls, and it was fall from a turret. Was one? I mean, they wanted me to tell them what they fell from. One was a flagpole. I'm like, a turret and a flagpole? Are you kidding me? How is this relevant? And it just went on, and it was actually really fun reading. But I thought to myself, why is that necessary?
If I can say, my favorite ICD-9 code was injury involving spacecraft occupant and injury involving spacecraft bystander.
So I stand corrected. It's not totally archaic coding system, but has some modern things in it.
Yeah.
Suffice it to say, there's lots of room for improvement and modernization, though.
Yeah, yeah. No, and all right, there's.
So we have an emergency medicine physician in Texas who said, but the ICD-9 has fall from aircraft injuring occupant of spacecraft.
Yeah, great stuff. No, as someone who does a little research, and I actually tried to look at a cohort of chest pain patients, I was floored by all the different ways that chest pain is coded for. And maybe unstable angina wasn't one of them, but there's chest pain not otherwise specified, there's cardiac pain, there's substernal pain, there's a million different ways to do it, or at least a couple dozen. And it sounds like, though, you found a way so that no matter how I talk about chest pain, I'm going to be able to get reimbursed for it.
Okay, so in my answer, we all need to be prepared to stand and salute when I say this. But accurate coding is extremely important, and physician documentation is the cornerstone of accurate coding. Why do we need accurate coding? Who cares? You gave one example. Anyone who reads the newspaper, listens to television, hears multiple examples every single day of the kinds of things that we're being asked in healthcare. What about equitable distribution? What about diagnosis and prevention, and all of the statistics and everything in healthcare economics? Everything requires accurate data. And it's the old garbage in, garbage out. If you don't have accurate data, you're not going to be doing very good research, and you give an excellent example of that.
Do you give any feedback to your physicians that are part of ChartWise, or does the system work well enough that the physician doesn't have to change the way they're writing their charts?
Well, let's talk about that for a second, because there are many physicians. As a cardiologist, I'm motivated to help the hospital. I like toys. I want my hospital to buy me toys. And if they're going to buy me toys, they need to be profitable. And hospitals are struggling these days. Not all physicians have that relationship with administration, but a very common phenomenon these days is the hospitalist, the full-time employee of the hospital. And they are actually being incentivized, and they're going to get a bonus if they're doing a good job with their documentation. They want tools to help them document.
It's not just hospitals.
And ER physicians, ED physicians today. Okay, and having the tools to be able to make it very easy. I'm being asked to do this anyway. As you know, at my hospital, I still practice, and physicians who know that I'm in this come up to me and grab me by the lapels and say, "What do they want me to do?" They're frustrated. They don't know what they're being asked to do by hospital administration. They don't know how to respond. This ChartWise CDI gives them the ability to respond in a very few mouse clicks and document their good citizenship and their behavior, and does show the very real financial impact. So the CFOs are happy too. The CFO doesn't really care if it's easy to use for the physician or not. They want that bottom line, and we can give them that as well.
Has your product been around long enough? Do you have any success stories to tell?
It's been around for about a day and a half now, and we don't have a single success story to tell about it. The technology has been in development since May, and we are rolling out here at the HIMSS show, but we have quite a number of physicians and clinical documentation specialists who are working with us, many of whom have established CDS programs, clinical documentation specialists, and they find that this still gives them a huge boost. So we do have a number of people using it, and the reception thus far has been extremely excited and enthusiastic, including a number of people who start off with the crossed arms and the body language that kind of says, "Show me." And then when they show them, it's like, "When can we have this at my hospital?"
Now, we've had some guests on our show that have talked about different ways of, processing physician charting data to enhance billing, like such as natural language processing. How are some of the nuts and bolts? How does your system work?
It can work several different ways. Let's just comment on that for a second. The natural language processing is very cool, but it's taking unstructured information, takes blobs of text, and tries to extract information from it. It does a good job. It's not a perfect job. That's one approach, from unstructured, pull the information out. We're working from the other direction, which is to provide the structured encoded input from the beginning. Okay. So you can just type a word or two. I can just type 3 letters, CHF. And it comes up and not only gives me the CHF, but it has an in-depth knowledge of the kinds of information that might also be helpful and shows me the modifications I might provide to it. So the expertise is built into the system. At the moment, there's over 30,000 rules that are built in the system with a knowledge of medicine and lab data and interactions and the diagnoses and the way they may interact with each other.
But if you're not replacing the EMR, then where is a physician seeing this kind of decision support or coding support?
So there are several answers to that question. One is in the small hospital that has no electronic EMR. It's a completely standalone system where they're doing the data entry up front. If you already have an EMR, it's very portal friendly in terms of being able to be called up for that patient from within the portal. And in the subsequent release, now I'm getting a little ahead of myself, but you did ask, it is fully embeddable inside of other people's technologies as well. That's not the product version that we've announced today, but that is basically the technology.
Maybe that's something for day 2 or day 3. Okay. Okay. Well, you have an exhibit here at HIMSS, is that right?
That's right. We have a booth, booth 815, if anyone happens to be listening in that area, and we would love to give a more complete demonstration. We've got the fully operational system. Actually, we've got 4 computers all set up. I may have mentioned that it requires no servers. It requires no technology. We happen to bring 4 very pretty computers just for demonstration purposes, but any modern web browser would do to be able to show it.
Okay. And for those of us who aren't at HIMSS, for those of us following the chat room, how can we find you online?
ChartWise Med, all one word, chartwisemed.com, and there's quite a bit of information there.
Okay, that's great. And so we've been with Jonathan Ellion of ChartWise Med, and thank you for coming down.
Thank you.
It's been a pleasure. Thanks, and we'll be back with more very soon.